Hello, Mountain House. This is Bryan Harrison with MHMatters, and we appreciate you joining in for another episode of Mountain House Health Matters with Dr. Chitturi. It's been a minute since we've done this program, and we're very happy to have the doctor back. He runs the Assure Primary and Urgent Care office, which you'll find in the Market Shopping Center next to the UPS store adjacent to Safeway. So if you don't know where it is, come down here and check it out and say hello. We're actually in the office this evening recording this, and Dr. Chitturi has brought with him some information for us on the influenza virus and things of that nature. So welcome, Dr. Chitturi.
Hi, Brian. Thank you.
Yeah, good to see you.
Good to see you again. Yeah.
So we just have a few questions. We're going to keep this quick. We're not going to keep you on forever, but we'll do a little bit. Before we get started, I know that you've been in practice here at this office for how long?
2 years.
Is it 2 years now? Wow.
Yeah, February, 2 years.
Wow,
Yeah.
Time flies.
Time flies.
Congratulations, that's
Thank
great.
You. Thank you.
And you also opened a practice, or you took over a practice in
Right.
Manteca. Correct?
We opened up another office called Pearl Pediatrics Primary and Urgent Care. It is located in Manteca at 330 North Gate Drive. It is primary care for pediatrics and urgent care for all age groups.
Oh.
Yeah. Name of it is Pearl Pediatrics.
So could your patients that would see you here, if they can't get in here, they could go over there? Or do you keep
Pediatrics patients can, yes, but majority of the monos patients will try to keep them here.
Yeah. Keep you close to home. All right, we have a series of questions that I'm going to ask and let the doctor talk to you, because that's why we're here. So let's just get started.
Sure.
All right, so we wanted to talk a little bit about the flu virus and how that's panning out this year. So what patterns are you seeing in the influenza season compared to last year?
So compared to last year was one of the severe influenza season that we had ever had. But compared to last year, this year there is, in the beginning of early winter and late fall, we had a rapid spike in influenza cases, and after that it plateaued, which means the spike has dropped or it's stabilized at that point. Last year it was a gradual increase and kept on increasing till end of spring.
It was bad
last year was bad. Severe tough symptoms were bad as well. But this year, by looking at the spike in the late fall and early winter, we thought it will be much severe, but luckily it has down.
So it's gone beyond the peak of it.
It's gone beyond the peak of it. It's on the down slope. But since we are in the valley area, and because of all the care for the weather and the conditions that we have here, usually the influenza season lasts till end of spring. So we are still seeing cases of influenza, but compared to December and January, it's less.
Are you seeing new variants or complications that healthcare providers should be prepared for?
So the variants of influenza this year, we are seeing highest number of cases in H3N2 variant of influenza, and the subtype is K. K subtype of H3N2 is the most predominant type of influenza A virus that is more predominant for this season, and it is different from the last season. And that is, and also in addition to other viruses, other types of influenza virus, this virus tends to have easy nature of spreading, like it can spread to patients easily, and because of its mutation in the antigens on the influenza, the vaccine that we have this year is unfortunately not able to capture all the virus. So that's why we are seeing many patients who are vaccinated also with some symptoms. But at the same point, that this vaccine definitely helps with preventing the severeness of the symptoms. So people with vaccines have less severity compared to people unvaccinated patients.
So even if it's not really matching up with the strand, I guess you'd say.
Yeah, strain, yeah.
The strain, then it still helps to
helps.
have been vaccinated.
Correct. How the influenza vaccine works is every year CDC gathers the data all across the world in the northern hemisphere and southern hemisphere with the most common strains for that season through the last few months before they produce the vaccine. They identify the common strain, most common 3 to 4 strains, and replicate them and make the vaccine. So every year the vaccine changes depending on that.
Right. And
So this
sort of
year,
hit and miss.
yeah, hit and miss, yeah. But this year, the strains that were shortlisted did not capture the H3N2 variant of influenza A with K mutation.
So does the virus present in a different way with the symptoms that people experience? Or how do they recognize that that's what they have?
Symptoms are mostly the same for all types of influenza virus. Matter of fact, most of the viruses causing the upper respiratory infections mostly have the same symptoms. But particularly for influenza, we'll have fever, high temperature, more than 102, 103, with generalized body pains, extremely fatigue, sore throat, cough, mostly dry cough, wet cough, stuffy nose, headache, and you feel like you're hit by a truck, like it feels the body pains are so bad. So that influenza.
In layman's terms.
Yeah, and because it causes body pains pretty bad. And if left untreated, the influenza can cause breakdown of your muscles. And when it happens, the muscles, when they break down, they release an enzyme in your body. The chemical that is break down from the muscles can block your kidneys. And eventually it can lead to dialysis too, if left untreated like that. So people think flu is just a normal thing, but if you don't pay much attention to it and leave it to wait until it gets worse, you might end up with dialysis. So it's that bad. It doesn't happen very often, but there is high chances.
Potential.
Most commonly, elderly patients with other comorbidities such as diabetes or hypertension or cancers or heart problems who are already immunocompromised because of these other medical conditions, they have a high chance of getting more complications. And younger kids who are unvaccinated will also have similar issues.
And you said earlier that it's been easier to catch this year?
Easy to spread because this
Easier
variant has been easy to spread, yes. But fortunately, compared to last year, the severity has been less.
Oh, well, that's good.
That's good, yeah.
That's not so bad. That was my question. So what preventative measures should people focus on, especially in a high transmission environment? If you're living with someone who's contracted it.
Right. So early isolation of those patients. Isolation means you need not be like during the pandemic time of COVID, you need not be in lockdown or anything, but make sure that if you are having some such symptoms and if you are around elderly patients or your family with kids and all, make sure that you have a mask, wash your hands often, and keep your surfaces clean, because the droplets can fall and somebody can touch them and the virus can be transmitted like that. So washing hands, wearing a mask, hydration.
Isolating, should people stay not?
Isolating with a mask should be enough. You need not stay locked down in a room.
So is it too late for people to get a vaccine at this point?
No, not really, because still we are seeing those variants from 2025. It is always good to get vaccination till end of spring.
Okay.
Yeah. Make sure that if you're not vaccinated, go to your doctor or your nearest pharmacy and get your vaccine.
And you guys offer the vaccines here?
We do offer the vaccine for always 6 months and above for a year. And your vaccine, most people don't even know the vaccine is covered by your insurance. It's part of the preventative measure.
Oh, nice.
Yeah.
You do other vaccines here too, I think you do.
We do like Tdap, tetanus shots and flu vaccine. Those are the 2 vaccines that we do.
You don't do shingles and...
We don't do shingles and all, but we send our patients to Safeway next door. They have all those vaccines. Yeah.
Well, that's good. So what other viruses have you been seeing?
So this every fall to spring we see various viruses, influenza being the most common one, and popular COVID. This year we have seen quite a few patients with COVID, and in fact even last week we had some patients with COVID positive infections. But again, it's now COVID has become like common flu with upper respiratory symptoms such as sore throat, cough, and runny nose and stuffy nose like that. Presents similar to influenza infection. Fortunately, it's not as bad as in pandemic time with hypoxia, like low blood oxygen levels or shortness of breath and all.
Well, and there's medication.
There are medications. So both for influenza and COVID, if treated in the early 1 to 2 days of time, there are antiviral medications which are specific for that virus. That's why early detection and identifying which type of virus you have and starting the medication at the early time prevents complications.
I actually got COVID last year. I missed it through the whole pandemic. I never had it. And then I got it last year. It's not great. So I also just heard about a new little known, I don't know if it's new, but a little known virus that's been hitting California.
Right.
The HMPV.
Yes.
Can you tell us anything about that?
Yeah, it is human metapneumovirus. It is a variant of very common virus called RSV, which is very common in kids. It's a respiratory syncytial virus. It is compared to influenza and all, it occurs mostly in kids. RSV occurs mostly in kids, but human metapneumovirus can occur in any patient age group. It is less severe than influenza and COVID, but still causes the symptoms of fever, sore throat, and and all. Again, early identification and make sure that you're well hydrated, at least 1.5 to 2 liters of water per day. Avoiding fruit juices and all, adequate rest will occur that.
Does that come with a cough too?
Mostly, yeah, cough and all. RSV virus itself will come with mostly wheezing and very bad breathing problem in kids. This HMPV also causes similar symptoms, but in adults also.
Is it about the contagiousness of it? Is it about the same as the flu?
It's about the same as flu, yeah.
Okay. Is there anything else that you'd like to share with us?
Just as I said, it's not too late yet for receiving your vaccine. If you are not vaccinated, please consult your doctor or head to your nearest pharmacy to get your vaccine. And if you have any symptoms of flu, make sure that you are tested early in the symptom stage so that you can get the appropriate treatment started on time.
Awesome. Well, thank you so much.
No problem. Thank you.
Thank you for tuning in. This has been Mountain House Health Matters with Dr. Chitturi, and we welcome your comments, like, share, and do all the things. Have a great day.
Thanks, man. Thank you.